So next we're going to do an intramuscular injection demonstration. We begin this by applying our lab coats in our examination gloves, our proper protective equipment. We prepare the injection to be administered. That includes determining the proper dose, the proper needle size, and proper syringe size, and make sure you have all that available. The next thing we want to do is have your assistant restrain the animal on the examination table, to prevent it jumping off, to prevent injury to both you and the animal in the personnel performing this procedure. You hold the animal with one hand on top of the head, one hand underneath the head, and one arm over the neck and thorax, just to keep the animal from jumping and moving around. You want to approach the animal, let them know you're there, talk to them and touch them. The most common injection site that we use for intramuscular injections is the large muscle mass that's in the hind leg. So you identify the injection site by placing your fingers around this muscle mass, squeezing to identify the femur, which is the large bone in that muscle mass, and then place your thumb on the outside of that to hold that muscle still. The injection site is identified and cleaned with a cotton ball saturated with alcohol. Then the needle is inserted through the skin into the isolated muscle mass of the caudal aspect of the leg, being careful to avoid going all the way through the leg and injecting one's own fingers. And you always aspirate the syringe by pulling back on the plunger to ensure that you have not inadvertently entered a vein or an artery. So if there's no blood visible in the syringe at this point in time, then you can go ahead and make your injection of the substance very slowly, allowing the material time to be dispensed into the muscle tissue. After injection is completed, withdraw the needle, dispose of the needle into a sharps container, and always massage the area where the injection was given to prevent leakage and make sure that the substance is properly absorbed. And then make sure you always praise the animal for its cooperation during the procedure.